All right, we talk about these various strains, these new variants, if you will, on COVID. But there's one particularly out of South Africa that is bearing a lot of watching, especially now that it's arrived in the United States and South Carolina, because it is not responding as other variants have to the vaccines that exist that are out there. Dr. Anita Gupta joins us, the Johns Hopkins University Medicine professor, anesthesiologist, physician. Overall, brilliant doctor, and I'm happy to have her here. So, doctor, this latest variant from South Africa, what makes it different from some of the others?
Well, look, what we have to, first of all, thank you for having me. What we have to keep in mind is that these viruses are continuing to evolve, and we just don't have enough information. What is so important to remember is that we have to emphasize that people have to get vaccinated right now, and that, that is utmost of importance, because these vaccines can protect against the most important virus that we're trying to protect people against. And until we have the information against these new evolving variations of the COVID-19 virus, individuals need to protect themselves, their families, to really get their protection that they need.
Doctor, I'm hearing a lot more cases of people who are getting the virus again after testing positive for it. Earlier, they get it again. And what is that about? I know these are people who obviously not had the vaccine yet, but is that typical? Because it's just more than a few cases, it's building.
What's so important to remember is that people need to get tested. The individuals that are getting it again, it's not sure what they have. Do they have COVID-19? Do they in fact have, do they in fact have it before? So it's so important. It's a case-by-case situation. Testing is so critical in those situations, verification of what they exactly had, and that's why, we have to emphasize to those individuals, do they in fact have the appropriate immune response? So in those cases, critical individuals to get that testing.
Real quickly, this issue of make it 2 masks, not just one, Dr. Fauci among those saying not a bad idea. What do you think of that?
Yeah, the issue of double masking, the simple answer here is that, look, people need to wear a mask. I think people are just not wearing masks right now. And I think the reason where the question of double masking is coming up is that there just really isn't enough protective equipment out there. Individuals are just wearing, a mask that may not have the proper filtration. So, the question of wearing a quality mask has come up. And so individuals are wearing double masks to have better protection. And we heard it from Dr. Fauci. It just makes common sense to have two. That just gives you better filtration and better protection.
Doctor, thank you very, very much. Good catching up with you, Dr. Anita Gupta.